So the changes of acute myocardial infarction on an ECG, they can be divided into three phases: the hyperacute phase, the evolved phase, or the chronic stabilized phase. The hyperacute phase refers to the time in which the ongoing injury is present, and it means that if coronary reperfusion is done timely, all the changes can be reversed. What are the changes? Tall symmetrical T waves, J point elevation, and increased amplitude of the R wave. Now, tall T waves, that is more than equal to 0.5 millivolts in the limb leads and more than equal to 0.1 millivolts in the precordial leads. Coming to J point or ST segment elevation, so there should be upsloped elevation of the ST segment, and it should be more than 1 mm in leads 2-3 AVF, 1 AVL, V4, V5, V6, or more than equal to 2 mm in leads V2 and V3 in males more than 40 years, more than equal to 2.5 mm in leads V2 and V3 in males less than 40 years, and more than equal to 1.5 mm in females. But all this in the absence of left ventricle hypertrophy or any bundle branch block. And for diagnosing it as an ST elevation MI, the changes should be present in more than equal to 2 contiguous leads, that is leads representing one area. For example, 2-3 AVF represent inferior wall MI. Now coming to the evolved phase, necrosis has occurred, and this is represented by new onset Q wave or increased depth of existing Q wave or decreased R wave amplitude, or ST segment elevation starts to decrease, or T wave inversion occurs, bundle branch blocks appear. The Q wave should be more than 20 milliseconds in V1, V2, V3 and V4, more than 30 milliseconds in others except for lead AVR and lead 3. Now for the Q wave to represent an old MI in lead 3, it should be more than 40 millisecond wide or more than 2.5 mm in depth. Now coming to the last phase, that is the chronic stabilized phase. In this phase, there are permanent Q waves and there is decreased height of R wave, also known as poor R wave progression, less than equal to 3 mm height of the R wave in lead V3, and the T wave is normal. Watch our next video to learn how to localize which exact wall has been infarcted in a myocardial infarction by looking at an ECG, and become an expert yourself.